Thank you so much. Welcome, John. So just to get started, here's a question. Raise your hand if you see a significant amount of symptoms like anxiety in the workforce. It's a good starting point. Exactly. So John, as someone that works with a lot of companies that are tackling that issue and many others, how would you assess the state of mental health within the workforce as a whole?
Yeah, that's a good question, obviously. Lee mentioned this morning, 80% of employees have had some sort of stress at work in the last week. I think that definitely, is true. We're in a mental health crisis. Between 20 and 25% of adults have had some sort of mental health condition in the last year. So it's significant. I don't know that this current generation of workforce is unique in the sense that there are stressors that are impacting their lives. I think that the visibility of those stressors has really grown up over the last 5-6 years in particular. It's certainly not what it was during the pandemic, but we've got stressors like return to office impacting people. We've got a new administration in Washington that's causing stress for some. So there's plenty to deal with, and obviously an opportunity for us to address it.
You mentioned 5 or 6 years. That's a pretty crucial 5 or 6 years, right? In terms of mental health and how it's affected, and both the physical relationship that people have with their jobs, whether they were frontline employees or suddenly at home, was a big one, as well as the emotional connection that they have with their jobs and dealing with a lot of times caregiving and other things. So the pandemic, of course, is the big story, but it's been a while. I mean, that's kind of old news. How have you seen the strategies that companies have evolved since that time? What's happened since?
Yeah, another good question. I mean, when the pandemic set in and everybody went home, the natural and rightful reaction from a lot of employers in the space was to try and get their hands on everything they could from a solution perspective. And they had to, right? They had to provide resources for their employees who were struggling. So it was, we'll take this, we'll take that, we'll take everything. And it wasn't necessarily a strategy. It was more a volume play. How many entry points can we give these folks to get access to care who need it? As we're kind of moving into a new phase now, a lot of employers that we're talking to, and health plans for that matter, are starting to get a lot more strategic with what they're doing. They have an opportunity to step back and kind of reassess, what has worked, what hasn't worked, where do we have overlap and redundancies, and where can we streamline access to care to make sure that the members that do need care can get access in a timely manner to quality care at the appropriate acuity that they're dealing with. So that's a good thing.
We certainly saw, from day one, we certainly saw a trend coming out of the pandemic and back into RTO and beyond of, just a lot of choices, especially, in the health and wellness and things that touched on health and wellness. I guess a question for the audience really would be, for those of you that are leaders in HR and benefits, have you experienced vendor fatigue? Did you guys how many of you would say that you felt overwhelmed by the number of choices in terms of health and wellness benefits? A little bit. How would the companies that you're working for respond to that issue of sort of too many choices?
It's something we hear quite a bit. I've been in digital health for over 20 years now, and the good news is there's always a new solution, right? In some cases, there's greenfield solutions that are coming to the market to address things that really haven't been addressed in the past. Musculoskeletal is a great example. When Hinge Health and Sword Health and Kaya and Kia came to market, there wasn't a lot of focus on those types of conditions. Now you're starting to see other areas either kind of still rising or starting to drop, but things like digestive health and the gut biome, women's health, thankfully, is taking more of a forefront picture, but it's a lot. If you look at Mercer, for example, in the benefits consulting space, has this thing called the clamshell, where they segment out all of the various vendors in the spaces, and there's over 200 of them trying to get mind share from the employers. And it's hard. It's incredibly hard to be able to digest all that and break through the clutter and the noise. So I think a really logical step for employers to ask their vendors in some way is figure out how to work together, right? A lot of this stuff is interrelated. A lot of it can overlap. And ultimately, if you're addressing multiple problems at the same time, you can get to a better outcome. That can be simple in some ways in terms of passing referrals to each other, sharing data, et cetera. But there's also an opportunity to create much deeper integrations where you're starting to look at care in a more holistic manner. and manage the whole person, as opposed to we're going to manage diabetes here, we're going to manage cancer here, we're going to manage hypertension, et cetera, in different spots. So,
are there misconceptions that people have when they take that holistic approach?
I think so, although I think some of that's starting to wear off a little bit. The mind-body connection, which is obviously something that Calm focuses on quite a bit, in part because of the pandemic and the new light that's been shined on mental health, has, I think, helped a lot of folks to understand that if you have a physical health condition, there's a pretty good chance that you're going to have a mental health condition associated with it. If you have one of the core chronic conditions like asthma, diabetes, COPD, heart failure, et cetera, you have a 50% likelihood of having some form of depression. And if you have multiple chronic conditions, it's 75% or more. And what happens in that situation, in particular, we use diabetes as an example. If you're not managing your diabetes well, chances are your depression is going to get worse. And if you're not managing your depression well, chances are your diabetes is going to get worse. So, it's a unique opportunity, certainly in those instances, to take a look at those conditions and many others and manage the mental health aspect of care as well as the physical health aspect, and you'll get to a better outcome at the end of the day.
I mean, Calm, I think, in the public mindset is often associated with sleep stories, meditation, sort of the original mission of the company. Obviously, Calm Health certainly incorporates, but goes well beyond that. How do you take a more comprehensive approach to health with that tool?
Great question. We're fortunate on the Calm Health side of the shop in the sense that one of our product leaders likes to say we're standing on the shoulders of giants, right? Like, we've got a 13-year track record of brand building and brand recognition that helps to make us a familiar, kind of destigmatized, humanizing access point. What we do beyond including everything, as you mentioned, that's in the consumer app, is take a more clinical approach to delivering the care and getting members to the care that they need. So when a member comes to us either through an employer-sponsored benefit or through a payer-sponsored benefit, as part of the onboarding process, they're actually taking the GAD and the PHQ question sets, and in some ways unwittingly doing so. If you're not familiar with those acronyms, there's a ton of acronyms in healthcare. The GAD is the general anxiety disorder, the PHQ is the patient health questionnaire, and those are clinically validated question sets to assess the level of acuity that a member has in anxiety and depression. If they come to us and they're doing great, they're going to get 2 questions and they move on. If they're not, they're going to get the broader question sets so that we can get a better handle around how are they doing from an acuity perspective. We're also asking them about their goals. So what is it that you're trying to work on? Is it lose weight? Is it manage your chronic condition better? Do you have life experience or episodic things happening like menopause or those types of things? And what other health conditions are you trying to address? That's a really good data set for us to get on the front end. And thankfully, because Calm is Calm, 93% of the folks that actually register get through that enrollment process. So that gives us a couple of opportunities. First and foremost, it allows us to take what we've learned about the member and curate what we're serving them in the app or in the portal based on those health conditions and what they've told us are important to them. But it also gives us the opportunity to partner with an employer, for example, to say, what other benefits do you have in your benefits portfolio that we can refer members to based on what they've told us? So if somebody comes in and says, I want to manage my diabetes better, and we know that that employer has Livongo or Omada or Virta or Vita, pick another vendor with a V in their name, we can create that referral pathway and say, hey, did you know you have this diabetes management tool in your benefits strategy? Let's get you over to the enrollment page so that you can start working with them. It works the same with us for mental health too. We are not a medium to high acuity service. We do what we do really well in terms of helping the 2/3 of folks that are mostly doing well and are dealing with episodic anxiety or depression. But we don't have therapists, and I don't, ever say never, but I don't think we ever will. So what we want to understand is, Tava's out there. If they have Tava as part of their benefits mix, let's get that member to Tava. If they're clinically appropriate for therapy, let's create that connection point. And in that point of care, explain to the member why it's important that they consider engaging in therapy. And then we have tools within the app that can help them go through a clinical program that says getting ready for therapy, or managing your diabetes, or raising a kid with ADHD, or dealing with menopause or other types of clinical topics that we can help support that member in between visits to their therapist or their physical health practitioner.
Yeah, you talked a lot about individual goals. You start talking about personalization. How important is personalization for these?
I think it's incredibly important, especially if you have the opportunity to gather that data up front and make what the member's seeing relevant. I'm in a demographic I won't lump you in, but middle-aged men are historically terrible at engaging in their healthcare, right? Like we don't wake up in the morning and think, well, I'm kind of depressed. I think I'll go to my benefits page and see if there's a therapist that I can engage with. It just doesn't happen, right? Like for us to go do our preventative on an annual basis is a miracle in and of itself. But if you have an opportunity to kind of disarm that engagement through an app, for example, maybe somebody comes in, they're like, I could use focus, so it's a soundscape at work, or I'm having trouble sleeping, it's a sleep story to help me fall asleep. That's a great entry point to get that member into the app. And at that point, after we've gathered all the information, now we can serve them information that makes sense for them, right? They'll look at it and say, oh, well, I actually do have diabetes and I could manage it a little bit better, so I think I'll go check out Omada and see what they can do for me. Trying to get folks to navigate that care, it's challenging, especially going back to what we said before. If you've got 7 different mental health conditions, services as part of the benefits portfolio, some people are just going to throw up their hands and say, I don't even know where to start. And so they don't.
You also touched on preventative care a little bit there. How does preventative care work its way into this journey for them?
I don't think anybody's born with moderate depression, right? There are things that happen in your life experiences that get you there. Sometimes it's physiological, sometimes it's the things that you're dealing with in life, but most folks start out at no or low acuity. And around 2/3 of the folks that we engage with our product fit into that category. They're in what we would call the green or the yellow. And that's where a lot of employers are starting to kind of sit up and say, we've done a lot, we think, in a strategic way to manage the folks that are in that moderate to high acuity. And by the way, low acuity from a PHQ for depression perspective is still a high acuity from a clinical parlance perspective. But being able to provide folks to help manage their day-to-day who are generally doing well helps them from hopefully sliding down that continuum into the orange or the red. So let's keep those that are doing pretty well, give them the tools that they can manage. And sometimes it's episodic. Maybe it's a bad breakup. Maybe you're going through grief and loss. You've lost somebody who is close to you. We can help manage folks through those types of episodic things and hopefully manage it well enough that they don't start to slide down that continuum of care.
Zooming out a little bit, obviously you have the company has a 13-year history. You've got a history that's, I think, around the same length or more. Tell me a little bit about what trends are you seeing over this period of time, more broadly than we've just talked about already?
I mean, we've talked about this, especially from a prep perspective. One of the great outcomes of the pandemic, well, there were several, right? Like one was you couldn't adopt a dog because all the shelters emptied out. There were so many pandemic puppies out there. But it did really do a nice job of shining a light on mental health and getting people to understand and be okay with the fact that they're not okay. And go out and access, in a lot of instances, the care that they needed. Now, we have a shortage in this country of practitioners. There aren't enough therapists or psychiatrists in many cases, especially geographically, to deal with the volume of patients that are now starting to raise their hand and say, I need help. I want to seek out that help. So there's a lot of things that are coming to market that can help bridge that gap where, maybe you're taking somebody that is low acuity or subacute and you're getting them a tool that's appropriate for them. But the other trend that we're starting to see in addition to managing that is that importance of mind-body connection and being able to manage all those things. And the more that the vendors in the space figure out how to talk to each other and work together, the more that's going to become more holistic in the end and deliver better outcomes.
Is there anything that's really surprised you in talking with your clients or traveling around and being in touch with your vendors?
There's always things that surprise me. Some of the strategies that are out there can be interesting at the end of the day, and it really depends on, in particular, the employers and what's important to them at that point in time. I would say the biggest thing that surprises me right now is, in some cases, the level of maturity of care in the payer space. There are some payers out there that just, they lack a really robust solution when it comes to providing mental health care, and in their solution, it's to contract with
Jargonize that a little bit. What's a payer in this case? You mean an employer
a health plan
specifically?
No, a health plan. So
Health plans,
some
okay.
of the health plans, their solution is to contract with a local network for therapy or for
Right.
psychiatry, and in many cases that's not adequate for their membership because they can't get in, or somebody's having a pretty significant clinical issue from a depression standpoint, and the first person they can see is a marriage counselor in 6 weeks. So I think there's a lot of opportunity in that health plan and that payer space to embrace new strategies to help triage members and give them support in the early stages while they work to get them, in many cases, a higher level of support that they need.
Yeah, and I think for a lot of employers, the benefit space, you cross that line, things are either are health insurance or they're not health insurance. But it sounds like you guys live in a world where you can kind of, maybe some of the best of both worlds, where you can help optimize that experience that people are having with the benefits that their employer is offering them.
Yeah, it's obviously a benefit for us to be able to do so. The strategies are always going to be dependent on who holds the risk, right? Like if you're a self-funded employer, then you're going to want to bring in solutions that can not only help serve your membership, but hopefully, ideally, have an impact on the bottom line too. In the payer space, for health plans, they're looking at their fully insured, their fully insured commercial, and some of the other government lines of business where they can reap the benefits from a cost-saving perspective. So the hope is obviously they're looking at it from a number of different angles rather than just the bottom line.
Got it. Changing gears a little bit, you want to talk a little bit about what got you into the space in the first place? Was there something that inspired your journey to think about mental health and wellness?
Yeah, I think everybody in the room has been touched by mental health in some way, shape, or form, whether it's their own experience or somebody that's close to them. I certainly have had those experiences with family members, and I haven't been perfect myself all the way through. So I had an opportunity really at the start of the pandemic to work for a different mental health provider, a company that was starting to do a lot of good, and unfortunately, it didn't end up well for a variety of reasons. And so I felt like when I exited that business, I had some unfinished business in the space, and was obviously thrilled about the opportunity to come to Calm and pick up in some ways where I left off and continue to do this work. So, has
your perspective evolved over time a little bit since you've joined?
Sure. I mean, you get a little bit jaded with some of the stuff that you see, especially, unfortunately, in a moment of crisis, there are opportunities to take advantage of situations, and thankfully, a lot of that stuff I think is shaken out, and ultimately, people are starting to focus their efforts on doing the right thing in terms of getting people the care that they need. That's certainly not absolute, but I think that's the trend that I've seen anyway.
Interesting. What are some things you could leave our audience here with? What are some takeaways that might help them if they were to walk out of this with a few new ideas?
Yeah, I mean, I guess going back to the earlier point, to the extent that you can, ask your vendors to work together. Give them the incentive to do so. Simple connection points can work. Deeper integrations are obviously better because then you have a better chance of getting the member to care when they need it. I think the other thing would be getting back to what I said before. Yes, you absolutely want to help the people that have that moderate to high acuity need, because they are the ones that need the help the most. But don't forget about the folks that don't have those medium to high acuity needs, because they could be there at some point if you don't give them the tools and the resources to manage their care when they're doing well, and provide that level of preventative care that many folks will absolutely go and access.
Are there any messages that leaders can convey to their teams around health and well-being that can help connect them with their team and help get them sort of oriented in the right direction?
Yeah, I loved some of the talking points in the chat this morning, where they talked about leaders showing vulnerability in some cases, and I think that's a huge piece, right? Like showing people that you are also human, and that while you may not be dealing with the same situations that they're dealing with, you have your own stressors, you have your own difficulties. I have 3 teenage boys. I have plenty that I deal with on a regular basis. But I think that's part of being a leader is showing them that there is a human aspect to everything that we do. And I think it was Connie that said, you still need to perform, you still need to be accountable for your work, but it's okay to be human, right? And it's okay to let folks know, either overtly or through accessing resources, that you do need help. And that should be, I think, something that organizations encourage, because things can turn out way worse if they don't encourage that openness and that willingness to engage.
Excellent. We're almost out of time, but what's next? What's next for you guys?
Wow, that's a big question. So Calm Health is relatively new when you look at some of the other solutions that are out there. It was really born out of employers coming to us and saying, we've got a lot of employees that really like Calm for meditation or for sleep stories or soundscapes or what have you. What can you do in the employer space? So we've evolved since our first iteration, which was Calm Business, into Calm Health, and we've really only been in the market for about a year now. But thankfully, we have over 14 million folks that already have access to Calm Health, either through transitioning from our old product, Calm Business, or through the health plan, the relationships that we've started. And obviously, I'm excited to have the opportunity to hopefully bring it to more folks to provide the care that the members need, or get them to the care that they need. So.
Excellent. Well, thanks. Well, in the name of bringing it to more folks, here's a few. Next up will be a coffee break. And if you want to see these guys, they're right outside that glass door. So thanks again, and we'll see you guys in a couple minutes.